Okay, this video is called The Truth About Black Men and Health. So if you just go for a walk in any university hospital and walk through the dialysis unit, that's the artificial kidney machine. He has a central venous catheter or an arm dialysis graft that connects the artery to the vein. And they suck out blood and they run it through a filtering machine. It's the artificial kidney of a dialysis machine. It is no fun. They go for dialysis 3 days a week for like 5 or more hours, and they feel lousy for a long time after that. So being in kidney failure is no fun. You don't want that. Okay, so the reason I show you this is tons and tons of middle-aged and older black men are on dialysis because of kidney failure. You know, quite often due to high blood pressure, hypertension. Okay, so I want you to go over some of this stuff because I'm going to talk about some of the common health problems in black men. And here's another thing. Hypertension is very high in black men, and it's often rather severe hypertension. Okay, that meaning that they're not just on one pill; they're on multiple different pills, and they're diagnosed typically at a younger age than other ethnic groups. Okay, and then these, some people say, oh, well, so what if I got hypertension? I'll just take the pill. It's not a big deal. I'll just take the pill. Well, let's take a look at these side effects, okay? Sexual dysfunction. They're messing up the blood pressure. You need good blood pressure to perfuse the Johnson and have an erection. So you don't want a lot of the effects of these pills, more impotence, sexual dysfunction. And then also some of them will say, well, dizziness. Well, if they're saying dizziness, and lightheadedness, that means you're not getting enough blood to the brain. And that means you're probably not getting enough blood to the Johnson either. So these could also cause impotence. So lots of these meds cause impotence. And a lot of black guys are on 3 pills, sometimes more, for hypertension. And what I'm saying is, the vast majority of patients, if they just eat low-fat, low-sodium vegan, they don't need to take any blood pressure pills. That's been the experience of McDougall. That's been what I have seen. That's what Pritikin has shown and others who have studied it. So you just go low-fat vegan. Okay, I'm just telling you that's what you could do to, get the best possible outcome. You want to fix problems sooner rather than later. The ascending thoracic aorta is like a second heart. When the regular heart pumps blood, the left ventricle, it pushes blood in the ascending thoracic aorta, which stretches it outward, and then it has elastic fibers that recoil inward, and they generate diastolic flow. So that you maintain more continuous blood flow through both cardiac contraction, called systole, and cardiac relaxation, called diastole. However, the longer you're hypertensive, the more you destroy these elastic fibers, and you cannot replace them after you're an adult in your 20s. So you'll end up more likely permanently hypertensive, less able to ever reverse it just with diet alone, the longer you wait to get your act together. So you don't want to wait on this. Most important vasodilator in the body, that means chemical that opens up arteries, is nitric oxide. Okay, it's produced by the arterial lining cells called the endothelial cells. It inhibits platelets, so it prevents the blood from clotting. That's good. It's a gas. So it not only travels into the lumen of the artery, it travels into the wall of the artery, and it causes dilation of relaxation of the vascular smooth muscles so they don't contract around the artery to make it narrow, and it relaxes and it opens up. You get more blood flow everywhere. That's what you want. The Johnson works better, and so does everything else, including the brain. Okay, this is just one article about hypertension in blacks. Relative risk of intracranial atherosclerotic stroke, like about 6 times increased. Other atherosclerotic strokes over 3 times increased. Lacunar infarcts in the brain over 3 times increased. Cardioembolic stroke 1.6 times increased. I've seen a lot more intracranial hemorrhages in middle-aged blacks than I have in whites, and it's from hypertension. Okay, I've seen a lot of hypertension strokes also in black women, especially if they've had a hysterectomy. Now here's a big article. This is one of the most important things in terms of health you're ever going to see in your whole life. This is actually a really big deal, this paper. You can hit the little button screensaver and keep this paper. Blood pressure in the African native. It's bearing upon the etiology of hypertension and atherosclerosis, so for hypertension. So up until the 4th decade, the figures of the 2 races approximately agree. After that, blood pressure normally in a healthy African population will come down. All right, so anyways, here's the point. This author, Donison, spent over 2 years at a native hospital in Kenya where about 1,800 patients were admitted. There was not a single case of high blood pressure ever encountered amongst the black adult patients there in Kenya. Not one case. If it was the United States, most of them would all have been hypertensive patients getting admitted to a hospital. Hypertrophied hearts, which is typical of hypertension, were very rarely met in the African patient. All right, so they had much less atherosclerosis in Europeans at autopsy. Okay. Well, I'm telling you, that's an incredible number, 1,800 consecutive hospital admissions and not a single hypertensive patient. Okay, so Kenya, they were eating a plant-based diet at that time. They eat a lot of this like cornmeal called ugali. But you'll see the same thing whenever you look at traditional ethnic populations where they eat plant-based diets. So now I'm going to talk about northern Mexico just briefly, that because as like an analogy to the Kenya, the blacks to the American blacks. So Kenya blacks eating their diet of plant foods, don't have any hypertension. American blacks, hypertension off the chart. And you see something similar in Mexicans in northern Mexico. Tarahumara eating the old-fashioned corn, rice, corn and beans and local greens. They're running 100 miles in 2 days. They're famous ultramarathoners. When they were pulled into America, standard American diet like the Pima in Arizona, they're off the charts sick, getting surgery all the time. So what I'm trying to say here is it's not genetic. And I mention it's not genetic because in medical school, they teach you blacks have more hypertension because it's genetic, okay? When I go to residency, I hear, well, they got more hypertension because it's genetic, coming from Africa, it's a hot climate, they retain salt, retaining sodium, causes vasoconstriction, dries up their pressure, and that's why it happens. There's nothing you could do. It's just genetic. That's BS. Almost nothing's genetic once you study disease in more detail. This is from a book called High Blood Pressure Solution by Richard Moore. And what he found out is that people just eat 5 times more potassium than sodium, they're usually not going to be hypertension. K is for kalium. That means potassium in Latin. Na is for natrium. That means sodium in Latin. And so basically, our ancestors probably ate 20 times as much potassium as sodium, whereas typical Americans eating like around 10 to 1 times more sodium than potassium. It's very easy to do. You just eat plant foods. P for plants, P for potassium. They got tons of potassium in them. You'll very quickly get more than this ratio of 5 to 1 potassium to sodium. And that'll likely dramatically improve blood pressure. And here's what it kind of comes down to. I call this, you can either take man's way of healing, which doesn't work, or you can take God's way. So man's way of healing is eat the lousy diet with meat, oil, processed foods, fried foods. Then they'll give you drug after drug after drug, which doesn't really work that well. Then you go for surgeries, chop, 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 dialysis and all this stuff. Bankrupt, bye-bye money, dead prematurely, okay? That's man way. It's expensive, it's painful, and it doesn't usually work. Here's God's way. Just eat the foods your ancestors ate, a whole bunch of plant foods, okay? We're designed to eat plant foods. I talked all about that in other lectures. Avoid toxins, get your sunshine, maintain some type of social support. Religion makes people healthier. Okay, you do those things, and you'll be a lot healthier. I call that God's way. It's free because you got to pay to eat food anyways, and you'll be happier, and it works, and your Johnson will keep working a lot longer too. Okay, looking at cancer. I'm going to show you what's in the books too, just in a moment here. Looking at cancer, a new number of cancer deaths each year. So this is for men, this is for women. Okay, the blacks have a real high incidence of cancer death. And so black men and black women. So what I'm trying to say is, they don't necessarily always get more cancers diagnosed because a lot of times whites or wealthy people, they'll go for all these screening studies. And let me tell you something, screening studies are a joke. They don't increase longevity. All they cause, they diagnose a bunch of what I would call fake cancers, ones that are real mild. They wouldn't have hurt them anyways. They would have been better off not knowing. But the blacks are really dying from cancer, okay? So they got bad cancers that are not curable and they die. Okay, and I'm also going to say people talk about screening. Why is screening such a joke? Number one, because you mostly find fake cancer, things that aren't really going to hurt you anyways. Number two, the idea of even screening implies that there's actually a treatment that works. For a lot of cancers, conventional medicine has no treatment. There's nothing it can do that makes things better. Yeah, it can operate on the patient or it can give them chemo, but for a lot of patients, surgery and chemo don't help. Okay, so you're just running yourself through a circle and not necessarily benefiting at all, It's like people who have a lot of experience with screening, they kind of laugh at it as being mostly a joke. Whereas people who don't know anything about it, they think it's the greatest thing in the world. Oh, I could win the lottery with screening. Yeah, you could also get chopped up and chemoed for no reason, okay? All right, here's prostate cancer deaths by race and ethnicity in the United States. Blacks have way more prostate cancer, and they're much more likely to die from it, okay? Here's the other ethnic groups down there. And one of the reasons why I show this is it relates like to black women having a lot more obesity. Estrogenic chemicals, they not only activate the breast for breast cancer and the uterus for uterus cancer, they activate the prostate. It's the hormonal equivalent in men of the female uterus. So being exposed to all those extra estrogenic chemicals will increase the rates of prostate cancer and of prostate cancer death. And then you know the answer, the Ornish study, etc., the experience of McDougall, you go low-fat, low-sodium vegan, you're much better off. And the other thing, too, is some people have this idea, well, the great doctors, the great medical institutions and universities will save us. And I'm going to tell you, I say this from a lot of experience. The current situation in conventional medicine is the modern medical research centers and universities, they're a joke. Okay, they're a joke. And the reason they're a joke is because no one really cares what happens to patients. I'm sorry to tell you that, but you need to know that. The reason is all the money comes from selling drugs or selling surgical devices and procedures, and it mostly comes from selling drugs. And because all they're trying to do is make money off of a drug, they almost never find anything useful. They made the so-called attempt to cure cancer ever since around 1970 and Nixon and all that stuff. And they've accomplished almost nothing. Almost nothing. And then they make rules. There's like a law. You're not allowed to say anything else is good for cancer but chemo. And what kind of bullshit is that? Why do they do that? Because they know their hold on the territory of controlling cancer treatment is weak. So they have to basically use, unfair persecution of anybody who tries anything else. They're preventing innovation. They don't want innovation. They're making billions of dollars selling chemo even when it doesn't work. Do you think they want to let somebody else take a try with something else, especially diet or something, which isn't going to pay hardly any money? No way. They're going to lie and cheat about these drugs until the end of time, as long as they can get away with it, okay? And they can get away with it because we have an atheistic system, atheistic Darwinism. Atheistic Darwinism basically says whoever's got the power and money can do whatever they damn well please. Regular people have no God. There's nothing special about them. They should be lucky they get the standard of care, and that's it, okay? So people don't understand that, but that's what it means. And what that means is, you can't trust them. You can't trust the university medical system. It's not honest. It's based on selling drugs. It does not allow diet therapy even to be considered. They'll mention, oh yeah, we consider diet therapy. We offer the Mediterranean diet. The Mediterranean diet's a joke. I call it the Antichrist. It doesn't work. It promises help or salvation, but it does not deliver. The Mediterranean diet's a very bad diet. Okay, here's Driven to Distraction. I show you this book about giving amphetamines to kids with attention deficit. Here's another book, Listening to Prozac. And the reason I tell you this thing is that these antidepressant drugs, they don't work. They cause a slow chemical lobotomy. A lot of them cause impotence. And what I'm saying is if they're willing to drug children with drugs that don't work and they know they don't work, you think they're going to care about you as an adult? No way. All right, here's some of the big famous Ivy League textbooks. Again, when I was a medical student, I thought these were, the ultimate. I was in awe of these books. Now I look at them as comic books. The Harvard textbook of pathophysiology. It's a joke, okay? What are they going to treat coronary artery disease with? Stents and surgery, okay, or crappy medicines like statins that don't work well, when you can cure the disease easily with low-fat vegan diet, okay? And you go through all these books. In the chapter on autoimmune disease, there's nothing about leaky gut. Nothing. I don't recall seeing anything on leaky gut. If they did, it was insignificant. Nothing about Swank or McDougall, two of the best doctors that were famous for treating autoimmune diseases. Hypertension, you don't hear anything about the big docs who really helped cure it. Kempner, Richard Moore, atherosclerosis, you don't hear about any of the pioneers. What I'm trying to tell you is all of these books hide the truth. They hide the useful information from the doctors in training and from the patients, okay? They're not going to help you. I'm just letting you know. Just so, because if you hold out thinking, oh, my doctor is real smart and good, they're going to save me, you're screwed, okay? If you open a book and realize, oh, by the way, this is some of my family, some of my cousins in Puerto Rico. I'm half Puerto Rican, half Irish, and I got black people in my family from my Puerto Rican side of the family. I just let you know that because I'm going to tell you that they sell you a bunch of lies. If you tell somebody your disease is based on if they tell you your disease is based on genetics, and that your disease is based on just getting older, that it's based on maybe an infection like maybe a virus, or they tell you your disease is because of racism, what are you going to do about that? What they're basically telling you with that type of lineup is that there's nothing you could do except take their pill and go for their surgery. They're taking your power away from you. And then when somebody comes along to help you, what do? They screw that person over. So I'll just tell you about this guy, Tyrone Hayes. He's a real famous scientist. And he was, had like a Harvard scholarship. And he was researching endocrine effects, including like this chemical called atrazine. That's the one they spray on the GMO non-organic corn, okay? So he figured out that it was an endocrine hormone like estrogen, and it would turn the male frogs into female frogs, okay? So you would think he should win a Nobel Prize for that. That's a great discovery. No, no, no. You don't know how medicine works. They got pissed off. The food company said, hey, who's this jerk? Tell him to shut up. Don't publish that. He published his papers anyways. They came after him, tried to fire him, take all his grant money away. He actually stood up and kept publishing his papers, but he became very hated, and they went after him, and they tried to make him as miserable as they could. I show you this stuff because that's what happens when somebody tries to help the public. They get attacked. Misinformation. Take away his funding. He didn't do his experiment correct. They just attack the guy. Okay, this is real standard. But you should know that when somebody tries to help you, they get attacked. So here's one of his papers, Tyrone Hayes, okay, first author on this paper. Atrazine induces complete feminization and chemical castration in male African frogs. Okay, so the point is that it turned the males into females. And this is what's in the food supply. This is what's subsidized. This is what is intentionally put in the most common food supply. You know, because corn is used to sweeten almost everything through high fructose corn syrup. And you'll have little trace residues of this atrazine stuff in there. I would never eat GMO corn. This is why. But I'm just letting you know this is what's going on. This is also why I think a lot of kids are confused about their gender, because they're poisoning these kids with all this atrazine and all this other crap. They got aluminum in the drinking water. They put in soy, they use for cheap protein in processed foods. They use corn for cheap sugar in processed foods. And it even gets worse than that. I have another slide somewhere. The atrazine is also a mitochondria inhibitor, meaning it's likely to decrease your energy level and cause brain damage. Okay, estrogen, we excrete a lot of it from our bodies by defecation. In the liver, it's conjugated to something called glucuronic acid, which is like a glucose with a carboxylic acid on it. The estrogen, E for estrogen here, it goes into your bile, and then it travels through your colon and you defecate it out of your body. But if you don't eat enough dietary fiber, and most blacks do not, you then will have a loss of the good bacteria. Good gut bacteria eat fiber. The bad gut bacteria eat other stuff. And they have more of an enzyme called glucuronidase, which removes this conjugation molecule here. So now the estrogen is cleaved and free. When the estrogen is cleaved and separate from the conjugation molecule, the estrogen is reabsorbed into the blood. So lack of dietary fiber from eating a lot of processed food, meat, and fried foods means you'll have bad gut bacteria, and your body's not going to be able to excrete estrogen in this way. So you're going to become estrogen overloaded, and that's going to increase your risk of prostate cancer. Okay, in women it increases the risk of breast cancer and uterus cancer. So anyways, here's a whole bunch of things that cause leaky gut, increased intestinal permeability. You protect yourself from that by eating dietary fiber. So the dietary fiber is taken by the good gut bacteria here with a smiley face. They convert it into short-chain fatty acids like butyrate. The gut lining cells, enterocytes, take that butyrate, they make it into tight junctions, the TJs, and that prevents stuff from getting across the gut lining. If you can't make these tight junctions because you never ate the dietary fiber, you got these other toxic chemicals damaging the lining, then you start getting bacterial endotoxins across this barrier. They can make the blood more prone to clot, causing heart attack, stroke, kidney damage, heart damage, brain damage. Big chunks of protein can get across because you don't have tight junctions here. And that can, when it comes from an animal, it can be similar enough to our body's own proteins that even though you form an antibody to it because the immune system recognizes it as foreign, the antibodies formed to it are a little bit confused because it's so similar to our own proteins that they'll sometimes attack our own proteins and cause autoimmune disease. Okay, so here's just an example of lupus. Lupus in blacks is real common. So it's especially black women, but man, that's a bad disease. And they have it in real high amounts, black women especially. And then I briefly mentioned that you'll get bacterial endotoxins like LPS and LTA getting across the gut wall with leaky gut. And it makes the blood more prone to clot, increasing the risk of heart attack, stroke, thickening the blood, causing more high blood pressure, hypertension. Okay, so that's the end. And what I basically just wanted to say is, you know, all you got to do is eat a low-fat, low-sodium vegan diet. You can watch my video about Spartan vegan diet if you want. And, you know, over about 90% of patients, it depends how long they've had high blood pressure, they got a good chance to come off all their meds. The longer they've had it, the more likely they're not going to come off all their meds, but at least some of them. The more you can control your blood pressure with a healthy diet, the better, rather than taking all these pills. You'll be much less likely to be impotent. You'll have probably better control of your blood pressure. In the long run, you'll be less likely to have a stroke or heart attack. It's all good. There's only positive side effects from eating this healthy diet. But I'm just letting you know, don't put your faith in that some doctor with a bag full of pills is going to cure all your problems. You can do a tremendous amount to help yourself by eating a healthy diet. And you'll simultaneously reduce your risk of hypertension, therefore reduce your risk of impotence, and you'll be reducing your risk of atherosclerosis in your heart and in your brain. So you'll reduce your risk of dementia, reduce your risk of heart attack. It's all good. You optimize your body weight. What more would you want? So anyways, that's the true story about health that seldom told to people.